Hello, um, good afternoon. I want to briefly talk about cervical cancer. What's prompted this wanting to talk about it is the discussion I had with one of my friends 2 days ago. And in fact, how it started was she sent me a message and asked me, is it true that cervical cancer is gotten from an unfaithful man? And then my reply was, even an unfaithful woman can get cervical cancer, that it is the virus from sexual transmission that causes the cervical cancer. And she was like, oh, that she didn't know, that had it been she didn't ask me, that she wouldn't have had this knowledge. I thought that yes, that it's the virus known as human papilloma virus is not only attacking the cervix. I know that it's a big cancer of the women, but it doesn't only attack the cervix, even the throat. If you are so into blowjobs, even anal sex, if you are into anal sex. So it's the virus. This virus is there on the cervix. It affects the anal and the anus, and then it affects the throat. That is what it does. And she asked me, why haven't you spoken about cervical cancer? And then I told her, not just in 2023, I had an online lecture that I invited a lot of people, but it was only about 10 to 11 people that attended, and then I gave the lecture. A lot of people don't know about this. They don't. And then I was like, oh, I think I should use this opportunity and talk about it again. We keep talking about it. Even you, who are you that is not into the health sector, if you know about this knowledge, you go out there and also teach people, let them know. We'll do it in chains, that when I tell you, you learn, you enlighten others, you move the knowledge on until it gets to everybody, no matter where you are. So it's good that it's good that you also teach other people when you listen to what I have to say. And then it's a preventable disease. It is something that if you are able to treat it early, just the testing, you start with the testing, you go for the test, you know what your status is. Like I told her, that particular day we were talking about this thing, I was just coming back from the doctor's office. I went to book an appointment where I moved to. It was part of their process as a woman. When you go to the country, that they will invite you, the Ministry of Health will invite you for HPV tests. When you make your appointment, you go to the doctor's office, you get tested, and then they give you back your feedback, your status. They will give you the vaccine, and then so on. And these are the things their government are doing for them to prevent this cancer at large. But since our government is not doing it for us, why don't you bring out the money from your pocket and make sure that you are well? You are well. You do the things you can do. You prevent a lot of things so that your well-being, for your well-being. So just if you walk into a hospital, especially general hospitals, you ask them about pap smear, you get tested. Vaccination, we talk about vaccines a lot of times. This vaccine is available for children under the age of from 9 years. You get the vaccine free for them, I think, to a certain stage, until you start paying from your pocket. But these children from 9 years to, I think, 13 years is absolutely free. So I had one experience, when I was at school camp in Enugu. Certain people came to give this information to mothers, to tell them, okay, bring your children, or your female children, get them tested. No, just bring them for the vaccine. And some of them were saying, it is not proper, that the vaccine is deadly, that is a way, that it is a way the government are using to, control children from giving birth. And it is a misconception, total misconception. These vaccines will prevent children from that year who are, around the age of sexual activities, so that you don't get exposed to this virus. That is what it does. But when you start telling people the misconception, you tell them the vaccine it will make you, destroy your womb, you won't be able to give birth. It's a misconception, and this is what I want us to start telling people. It doesn't work like that. It prevents you from getting this cervical cancer that comes later in life, in middle age, when you go to UNTH. Because I worked at UNTH, and when I was working in FEM 5 gyno oncology, there were a lot of cervical cancer cases. There were other cancers, but this cervical cancer, it comes like they flood into UNTH, and we were seeing a lot of cases on this, something that would have been prevented. But some of these people don't even know what cervical cancer is. And that is why we are here. That is why I'm here to talk to you about cervical cancer. At least it starts with the knowledge. You have to know that cervical cancer exists. And then what is the next step after knowing that cervical cancer exists? The next step is to go for pap smear. It is affordable. It's something you can do. Take a pap smear. Then the next thing, vaccination. You get prevented from this cervical cancer. And that is why I'm here, just to talk about it. But then this is not a lecture. It's just a brief thing that I want to say about cervical cancer. If you have any information that you want to, if you have anything you want to ask, any information you want to get about this cervical cancer, you can ask me. Just send me a message. I am always willing and ready to talk to you about cervical cancer or any other thing, any other health related issues, not only cervical cancer. I'm here for you. Take care of yourself. Bye.